I'm Dr. DeShawn Taylor, and I am coming to you today from Phoenix, Arizona. I am talking about the HPV vaccine and how it prevents cancer. This is World Immunization Week, and so what better vaccine to discuss today than the human papillomavirus vaccine? So once again, I'm Dr. DeShawn Taylor. I am a board certified gynecologist and family planning specialist, and I am the owner and primary provider at Desert Star Family Planning Clinic in Phoenix, Arizona. And I want to thank you all for joining me live today. And definitely, if you have any questions, drop them in the chat. I have people watching out for those so that I can make sure that I include those today. And so let's start off with a little bit of background about the human papillomavirus. Now, this is a very common virus. Almost everyone who is sexually active will contract or be exposed to the human papillomavirus at some point in their lives. And so generally, this virus is cleared by the body. However, if it is not cleared, then it can eventually cause 6 different types of cancer and also genital warts. And so the HPV vaccine has been around since 2006. And so since it has been available, it has drastically decreased the diseases caused by the human papillomavirus, genital warts, for example, and some of the precancerous lesions that we pick up on pap smears for cervical cancer screening. And so the HPV vaccine can cause about 36,000 cancers in women and men every year. And so the HPV vaccine can decrease those cancers by about 90% by preventing the HPV infection that, if unrecognized, eventually leads to those diseases. And so the types of cancer that the human papillomavirus can cause include cervical, vaginal, vulvar, cancers of the penis, cancers of the anus, and cancers of the oral pharynx. And that includes the back of the throat and the tonsils and the base of the tongue. And so as you kind of think about this, you're like, oh, okay, these are areas of the body that are involved in sexual activity. And so yes, HPV virus is contracted with sexual activity. And this has become a bit of a source of contention around parents vaccinating their children, right? Because parents don't want to think about their children being sexually active. And it is recommended to provide the human papillomavirus vaccine as early as 9 years old. And the reason that that recommendation exists is because early prevention is better, right? So if we are providing this vaccination to individuals before they become sexually active, then that is going to confer more protection against these HPV-related cancers. And so the Center for Disease Control recommends an average age of 11 to 12 to begin vaccinating, and as early as 9, and to vaccinate up to the age of 25. And so the vaccine is available now to people beyond the age of 25, so between 26 to 45. If you meet with your doctor and you determine that there is still some benefit for you to be vaccinated against the human papillomavirus. And we do know that some health insurances are starting to cover that as well. And so when your child is vaccinated prior to the age of 15, it requires 2 shots, and those shots are 6 months apart. And then if the vaccination starts at age 15 or older, then 3 shots are required at that point. And so you want to vaccinate. So we think of the date of vaccination as 0 of the first shot. And then the next shot is generally in 2 months. And the third shot is generally in 4 months. And if you want to think about it, it's really completing the vaccine in 6 months, just like with the earlier age dosing. But the reason that 3 shots are required is because people may have already had some exposure to the human papilloma virus through sexual activity. And you still may not be compelled, right, to vaccinate yourself or have your child vaccinated. And so, okay, I have a question. So the question is, if you already have HPV, should you still get vaccinated? So yes, definitely if you are younger than age 26, there is definitely still some benefit to getting the HPV vaccine, because what happens is your body can clear the HPV that you already have, and then having the vaccine will prevent you from being from getting that again. So basically, as long as you're sexually active, you have the opportunity to be introduced to the HPV vaccine again. And so there are specific strains of the virus that cause genital warts, and there are specific strains of the virus that causes the changes in our cells that eventually could turn into cancer. And so I actually have seen a patient in my practice who had gotten the HPV vaccine as a child. And so when we actually did the typing of the abnormal HPV that was picked up on her pap smear testing, it actually was not one of the HPV strains that she was vaccinated against. And so we had that conversation about, wow, well, you know, that's really good to know that she does have the protection from the vaccine, but there are so many different strains that the vaccine doesn't cover all of them. And so it's just kind of like when you think of the flu shot, for example, you get the flu shot and it's configured with most of the most common strains of the flu, but however, you could still get the flu. And so it's pretty similar in thought about being exposed, potentially still getting HPV, but being protected by most of the common strains of the virus. And so fewer teens and young adults are getting genital warts, and the number of cases of precancerous abnormalities in people who undergo cervical cancer screening has decreased significantly over time. And so prevention is key, right? We want to prevent cancer. We don't want to have to treat cancer. And so it's important we think about HPV a lot because we do pap smears in people who have a cervix, and we generally are thinking about this as a female disease. However, 1 in 4 of the HPV-related cancers are diagnosed in men. And so it is very important for us to have our boys and men vaccinated as well. The other important aspect of this is that if people are immunocompromised, like having an autoimmune disorder or having HIV/AIDS, your body may not be able to clear the human papilloma virus on its own, and you may be more susceptible to the effects of HPV and the health-related problems and potentially cancer that are related to having an HPV infection. So it is strongly recommended that you be vaccinated. And when people have an immunocompromised status, it is recommended, regardless of age, to actually get 3 doses of the vaccine. And so, like anything medical, there are the potential to have side effects. And so when you get the vaccination, some of the most common side effects are fatigue, pain at the injection site, mild headache. And there also is the possibility of being allergic to the vaccine. And so if you want to talk to your healthcare provider about some things that you might be allergic to that might be components of the vaccine, and you might have to avoid taking it if you may be allergic. And so again, I just want to recap for you that the human papillomavirus is very, very common. 80 million people have the human papillomavirus, and it causes somewhere around 36,000 cancers a year. 14 million new cases of HPV are diagnosed in teens and in young adults annually. And so this virus can cause 6 cancers, and the only one of those that we are actually screening for is cervical cancer. And so we do not know who, once exposed to the human papillomavirus, could eventually end up with cancer. Cancer is very slow growing. We may see effects of the HPV infection years or decades after the initial exposure to it. So being vaccinated is a very good opportunity for protection. And so again, those cancers are cancers of the cervix, the vagina, the vulva, the penis, the anus, and the oral pharynx, which includes the back of your throat, the tongue, and tonsils. And again, these are areas which are commonly associated with sexual activity. And so the earlier that someone is vaccinated, the better. If you've already become sexually active and you're still under the age of 26, it is definitely beneficial to go ahead and get vaccinated, because our body generally clears the HPV, the human papillomavirus, but you can be exposed to it again. So being vaccinated will protect you from future infection. I hope this was good information for you. And if you found this helpful, definitely share. We have this on Facebook. We'll upload to IGTV, and also we're streaming on YouTube. And follow us on any of those platforms. And I'll be going live the 2nd and 4th Wednesday of the month with new topics. You guys have a great rest of your week, and see you next time.